The second thing physicians need to do is improve their communication skills. When you're trying to ensure patients understand, you can slow down. Don't speak so quickly so that the patients can understand what you're saying.
Well, you're right about the arthritis.
Okay.
It does affect the joints.
Yes.
Patients or anyone can only remember 1, 2, or 3 things from a conversation. Identify what's most important to teach that patient and ensure they understand that before they walk out of the door and go home.
In the form of arthritis that you have, which is the most common, usually what happens is that inside the joint there are 2 bones, at least 2 bones.
Okay.
And the bones are just rubbing off.
Use living room language. Use language that anybody walking on the street would understand, not just a nurse and another doctor.
You mentioned earlier that you were working on your home.
Yes.
100 years old. You noticed my door. It creaks. It wears down. That door has a little oil, so it doesn't creak. When that oil wears off, it starts creaking.
What was interesting is that he used visual aids in the sense of he made a visual picture of what was going on, describing arthritis as being a joint in a door frame and not having oil. So this really helps out in the fact that you have a visual picture of what might be going on in your body.
It doesn't matter whether people are highly educated, because this stuff is difficult to understand.
They're not doctors. And since they're not doctors, they shouldn't understand doctors' terms.
I am married to an engineer now, and this man has some health issues, so we are in the doctor's office from time to time. We will walk out of the doctor's office, and my husband, with all of that left-brained intellect, will say to me, "What did the doctor say? What am I supposed to do? I don't understand."
Mary brought in her husband, and it was very clear from the beginning, once they were together, how they have a dynamic that works. And the majority of the things that she does in healthcare, she may not be able to go 100% with it, but he's there to fill in the gap.
I use a lot of posters. I have lots of posters and models, and I think people remember it better if they can see it, or if it's associated to something that they understand already. So I think the models and the visuals all make a big difference.
If the patient comes in with medication, a lot of times they're on so many medications, they're confused on when to take it, what it's for. So we do have a medication compliance sheet. And we do actually tape a pill that they bring in out of their medicine bottle. We tape it to the sheet, we write down when they take it and what the medication's for.
It's really important that you don't say, "Do you understand?" Because they're going to say, "Yeah." And that'll be the end of it, and you won't know what they understand. They may understand, but it may not be what you said. I think I use a teach-the-teacher mechanism. It's like, now that you know this, I know you've got friends. When they ask about this issue, how are you going to tell them? What are you going to say? Well, one of the things that you can do if you have a really bad pain, I mean, where you can't stand on it and it's really getting in your way, is to use what I call, this is my little pain protocol here. It has ibuprofen, which decreases those little cells I was talking to you about, the inflamed part, and your Tylenol that just works on the pain. And the I is for ibuprofen and T is for Tylenol. And this just shows you how to do it over the course of the day. For breakfast, lunch, and dinner, there's an I, so you use ibuprofen.
Right.
Because you have to have something on your stomach.
That's right.
With that one.
Yeah.
Because this one will irritate your stomach.
Yeah.
So in between meals and at bedtime, you use a Tylenol.
Right.
This way you get something every 3 hours. You don't overdose on either one. So it's IT, IT, IT. And if you do that for a couple of days when it's really bad, then you can just go back to your regular regimen. But this usually breaks the pain pretty nicely. So I know you have a lot of friends with arthritis. How would you explain it to them?
Well, for breakfast, I take I. 10 a.m., I take T. Lunch, I take I. 3 p.m., I take T. I at dinner. And T at bedtime. Is that correct,
That's
Doctor?
going to work just fine.
Thank you very much.
I think there are a lot of simple things that physicians can do to improve their office and make it a shame-free environment. There's a lot of simple things doctors can do to ensure their patients understand them and ensure these patients have better health.
As we've seen, a shame-free environment is one that conveys an attitude of helpfulness. It's a safe place where patients feel more comfortable and are more likely to reveal literacy problems. Engage the entire staff. And remember, there are clues that indicate the possibility of low health literacy, for example, incomplete forms. Clues can also come from the information derived from the social history and insights gleaned from the medication review. As far as improving communication, keep in mind these simple techniques. Slow down, use living room language, convey only the most important concepts, involve family members, use visual aids, and employ the teach-back method. The physicians you have just seen are using a variety of communication techniques to better inform their patients. As research continues to unearth best practices, we ask you to join them and all of us at the AMA in finding and implementing simple ways to communicate with all your patients. Please let us know what techniques you have tried and what has worked in your practice.
There's no question. When a patient understands how to take their medication, when a patient recognizes that the physician really cares about them, their face lights up. And that is so gratifying to see that in a patient, that they know their doctor cares about them and that they now know how to best take care of themselves.